Well, good evening, everyone, and welcome to our hospital forum today. Thank you, everyone, for joining in. I know that there are a lot of different things that people could be doing today, so we are so very appreciative for you taking your time out today to listen and receive some wonderful information from our panelists and ask some poignant questions so that we can walk away more educated about North Lake County Hospital District. So I would like to begin by introducing the candidates. So today we have with us Melody Duckins, me, Khalid Sattar, and Pam Janelle. We have 1 minute to introduce ourselves, and then I would like to introduce the panelists. I'd also like to give a quick thank you to Nancy Hulbert. She is here from the Democratic Committee. She is chair of the Lake County Democratic Party. I'd like to thank her. And Jane Hupting isn't on the, you can't see her face, but she's here and she's a campaign committee chair. Thank you so much, Jane. And thank you so much, Susan Fetter, for doing the graphics and the social media. So my name is Melody Duckins, and I am running for North Lake County Hospital Board, seat 5. I am working currently at Beacon College, located in Leesburg, where I've worked there for about 2 years now, and I am a resident of Lake County. I am pursuing a seat on the board because I am a supporter of the North Lake Taxing District, and here's why. Quality health care and services is important to me, as I'm sure it is to everyone. And part of the funds that are collected from the taxes go towards providing state-of-the-art equipment to better serve the patients that are in need. The second reason that is important for me is affordable health care for the uninsured and the underinsured. These are the reasons why I am running for seat 5. These issues are important to me, and I believe in them strongly, as I believe in the taxing district. My name is Melody Duckins. I'm running for North Lake County Hospital Board, seat 5. If you have any questions, you can reach me by email, melody.duckins, that's melody.duckins@gmail.com, and by Facebook, elect Melody. Thank you so much. I appreciate your vote on August 18th. And again, thank you for coming out and sharing in today's event. The next person I would like to introduce themselves is Khalid Sattar. Thank you.
Yeah, hi, good evening. My name is Khalid Sattar. I live in Lake County for almost 14 years, and I just joined this group to be on the board because I had a business in Leesburg for almost 13 years, and that business was around the community where a lot of homeless people live, and we used to see them. They have a lot of issues with their health, a lot of issues with their personal lives. So I was thinking I can help them in that way, but for that we have to go to the boards and hospitals to get them done. So I'm running for this seat to see if I can help them out and other people, because health insurance is very important for us, for all of them. So this is what I'm running for. I'm hoping for you to vote for me. My email address is sattar.k@gmail.com, and I'd appreciate your votes. Thank you very much. And next one is Pam, who's going to be running for another seat. So Pam is next, please.
Pam, unmute yourself.
Thank you. Someday I will get the hang of Zoom meetings, I promise. So I am Pam Janelle, and I think that my work history has really prepared me to sit on seat 1 in the North Lakes Hospital District Board. I've worked with many community-based organizations and social service agencies where I have built the skill of establishing relationships with community partners and volunteers. The last decade of my career was spent with Florida Hospital, which became Advent Health, shortly before I left. I began as a research coordinator and finished my career as a project manager with Creation Health. I continued to work with community stakeholders in those roles on a much larger scale, and I also learned to seek out evidence and facts to improve the care that Advent Health delivers to its patients. I have a BS degree in psychology from UCF, a master's in health informatics from the University of Illinois at Chicago, and I'm ready to assume seat 1 of the North Lake Hospital District. I want to ensure that our clinics and hospitals can continue to serve all the residents of the district with quality health care. And I hope you'll vote for me, Pam Janelle, on November 3rd. Thanks. Melody, back to you.
Thank you so much, Pam. Thank you so much, Khalid. I'm going to say I'm really glad that Jane is not with us visibly on the webinar, because she would put up those red sheets saying that we've run over time. Now it's my honor and privilege to introduce the panelists today. And I would like to begin by saying that so appreciative of you taking the time out to share with us all the services and benefits that you're offering the community, and to share in your expertise and to give us a little bit more knowledge about North Lake County Hospital District. So joining us today is Advent Health Waterman, Community Health Centers, UF Health Central Florida, and Lifestream Behavioral Center. Joining us from Advent Health Waterman is Mr. David Otati. He is the President, CEO of the Central Florida North Division. Ms. Anita Young, Senior Vice President and Chief Operating Officer. Ms. Melissa A. Sims, Director of Outpatient Centers and Community Services. Mr. David Otati, would you please give a brief introduction of your hospital, clinics, the people you serve, your services and benefits? Thank you.
Thank you, Melody. I appreciate it. And thank you, Nancy, for all the work that you guys have done in putting this together. I truly appreciate it. When I look at the forum, it's always hard because we see just a few folks on the screen, but I always like to see everybody else in the room. And today we won't be able to do that too well, but I do appreciate the folks that have logged on and those that are also asking questions on the chat box too. Thank you for that. We would like to answer as many questions as we have here, and if there are more questions, always feel free to reach out to us individually, collectively, however you'd like to. But we want to make sure that folks are knowledgeable and understand what we're doing, how we're operating, and I know that could take a lot longer than just a few minutes, but there's a lot of really good things happening in Lake County. My name is Dave Otati. I'm part of Advent Health. I've been with Advent Health for about 23 years. For about 4 years, I served as the CEO for Florida Hospital, for Advent Health Waterman. Did that for a number of 4 years, and then now I'm working in a regional capacity, so still responsible for the Waterman facility. The CEO, Abel Berry, he could not make it here today. He is on a personal matter and was not able to attend. I know he would love to be here, but Anita Young and Melissa Sims are here as well, and they'll talk a little bit about the clinic and some of the things that we're doing there. Advent Health Waterman is a 300-bed hospital. We've been around for many years. It became part of Advent Health in the 1990s. Since then, we invested and built a new facility there, and in the last 5 years, we've invested over $100 million in additional construction and components to continue that organization and continue our investment in Lake County. We are owned and operated by Advent Health. Advent Health is a nonprofit, faith-based organization, and we have a mission to make sure that we take care of the communities of which we serve and to invest everything we make right back into the community. And if you take a look at what we've done over the last few years, let that be kind of let that be our are proof that we really want to be in Lake County and we really want to make Lake County a better location. We have services from OB, PEDS, open heart, inpatient rehab, med-surg, ED. We see 60 to 70,000 ER visits, inpatient, outpatient, a whole network of physicians and other components as well. And as we see the needs arise in Lake County, we want to make sure that we're continuing to invest the right infrastructure, the right people, and the right things so that we can make Lake County a better place. We recognize that when you hit 65, you're five times more likely to use healthcare services, and we want to make sure that healthcare services are right for the community of which we serve. So that's kind of what we're doing in a nutshell. Anita, if you'd like to add that, and then maybe Melissa.
Because you see a lot of people joining, you can join too. No. He said you can join. He said they're looking for more people to join.
You can hear somebody in the background. Maybe that person might be able to mute themselves.
Yes, hi, Khalid, would you mind muting? Thank you so much, sir.
Unless it's a really good conversation, then you can talk louder and then we can all hear. But Anita, anything you would add? And then Melissa? You're on mute, Anita.
You're on mute, Anita. Unmute yourself, Anita. There you go. Nope, you're still muted.
Let's jump to Melissa, if you will. Melissa, if you can talk a little bit about the clinic.
Can you hear me okay?
Yes.
Okay, great. So hi, I'm Melissa Sims. I'm Director of Outpatient Centers Community Services. I have actually had the privilege of working at the clinic my entire career with Florida Hospital Waterman, now Advent Health Waterman. So I've been there over 12 years already. And it's just a wonderful place. We see patients who are at or below 200% of the federal poverty level, uninsured. So it's a great privilege that I get to help those in our community every day. So thank you for having us.
Thank you. Anita, I don't know if we're going to be able to hear you just yet. You may have a sound issue, so we'll turn it back over to Melody.
Okay, and you know what I'd like to say? We'll go on to Mark Dickinson from Community Health Centers. And I would ask that, Mark, if you could answer the same question.
Okay, I was having some technical troubles. If you could just repeat the question real quick for me, I appreciate it.
Sure thing. It's just if you could just give a brief history about who you are, your organization, and who you serve.
Oh, sure. I'm with Community Health Centers. We are a federally qualified health center organization. We were organized in 1972. We currently have 14 locations, 5 in Lake County, 2 in the North Lake County District. We serve 250,000 medical visits a year. And our primary target are uninsured, underinsured, and underserved. That's where we try to have our where we put our health centers in those kinds of communities that are basically underserved.
Wonderful. Thank you so much, Mark. And it was a pleasure speaking to you over the phone and visiting your facility. John Reardon gave me a great tour. And so you have a wonderful facility there. And as well with Melissa, Melissa gave a great tour. Pam and I visited, and she even protected us from lightning coming down and almost splitting the center, and she was just a brave soul. So it was really great. The next question goes to Mr. John Henderson. Again, if you could tell us a little about yourself, your facility, the people that you serve, and if Phil is in there, he can give a little bit of quick history of, not history, but explanation of North Lake.
Hey, good evening, everybody. Can you hear me okay?
Mm-hmm. Yes.
Excellent. Well, thank you for allowing me the opportunity to speak on behalf of UF Health Leesburg Hospital. UF Health Leesburg Hospital has been around for almost 60 years. It was formed in 1963 through the work of community citizens in the Leesburg area, and since then has grown from a relatively small 60 beds to 353 licensed beds. And so through the years, we've tried to do everything possible. We have a community board that's made up of 16 community members that have worked tirelessly to try and improve medical services for the community. One of the historical things, which I hope we can talk about later today, is the decision to affiliate our two hospitals, Leesburg and the Villages, with UF Health effective January 1st. We think this will be a major step forward, both in our own development, but also in the availability of medical services for the region. And with that, I'll turn it over to Phil. Phil, would you like to add anything about the tax district? You're probably the grandfather of the district effort. So
I do have a lot of gray in my beard now, so it didn't used to be there. But yeah, I just the tax district, it's an independent special district. It was formed over 50 years ago. In 2012, there was some new legislation that recreated the district, actually brought a lot of accountability and transparency with auditors and some resources for the district that they use to audit the claims by the providers. So that was a good thing. And then in 2016, there was a vote to keep the district for another 10 years. And that vote will come up again 10 years from now in 2026. So the way the district works is it's actually governed by six elected board members. They have 4-year terms. They rotate. There's 3 that get elected and 3 more that get elected every other year. They actually determine the rate for the millage to use for funding of indigent care in the district. So when an indigent patient comes to one of the providers, whether it's a hospital or a free clinic, that bill is then submitted to the district for payment, and that allows that resident not to have to deal with that bill or have that bill stay with them or be followed up with. So it's really a good thing, and it helps them move on and pass. They're already dealing with a healthcare issue or having some healthcare issues. This really is a great thing, and that's really kind of what the district is and how it started.
Melody, unmute.
Yes, great, wonderful. It's hard to press that button. I swear I was doing the right thing. So thank you so much, Phil, and thank you so much, Dawn. Appreciate your input. Last but not least, we will go with Livestream. Rick Hankey, could you please give us some background on who you are and your organization?
Yes, good evening. My name is Rick Hankey, and I am Executive Vice President for Livestream Behavioral Center. Just to tell you a little bit about Livestream, we are a not-for-profit, community-based organization that's entering into our 50th year of services. We provide services in 7 counties, and we provided over services to over 27,000 people last year. We provide what is considered a comprehensive system of care, meaning we provide acute care services, we provide services in the schools, we provide services in the jails, we provide services in the community. We are, you can see from our facilities, we're all over Lake County as well as the other counties that we serve. We operate a psychiatric hospital, and the hospital district helps pay for some of the indigent beds. We also have, which is very unique, a integrated primary care facility. Unfortunately, individuals with serious mental illness die 25 years earlier than the general population due to lack of primary care or them accessing primary care. And we are able to provide those services to our population. So we're very excited to be here tonight to talk more about our services and what we do and how the hospital district is a benefit to our services.
Okay, well, thank you so much, Mr. Hankey. Now let's begin with the questions. When I ask these questions and the other candidates, it's up for grabs. We would just ask that you try to keep it brief so that everyone can get an opportunity to respond. We begin. Judge Metz stated in the Orlando Sentinel 2016, "We don't need this district. It was established when this population was rural. Furthermore, the healthcare landscape has changed drastically since this district was created." Panelists, first question: how important is the district and the community it serves?
Don't everybody jump in at once.
I think we're all a little shy with our mute button. I'll go ahead if you don't mind. I think that the district is a critical piece to this community. For us, it's an avenue to be able to provide services to the uninsured, to the homeless, to the underinsured, people that would not be able to access services. I want to share with you just a few statistics as they relate to behavioral health. 1 in 4 Americans are affected by mental disorders, yet 56% of the Americans are not able to access treatment resources. Florida is last in the nation with regard to per capita spending on behavioral health. The area that we're located in, Circuit 5, is amongst the bottom quartile with regard to per capita spending for behavioral health. So unfortunately, if we want to be able to provide services to those that can't afford services, we need to have funding sources like the hospital district. Without that, we would not be able to provide some indigent beds. We would not be able to provide primary care to a very vulnerable population. So what does this mean to our community? This means that those individuals would not get care and would have to go to more expensive and other means of treatment, like our jail system, the emergency rooms, or they would go untreated. And we know that untreated mental health often leads to substance misuse as well as crime. And while there is this misnomer that people with mental illness are violent, they're often the victims of crime, not the perpetrators of crime. With that, we know that we have saved lives in our primary care clinic. We have served people who have never in their adult life have seen a primary care provider because they weren't welcome or they weren't comfortable going to see a primary care physician. We had individuals come to us with uncontrolled diabetes, with hypertension that should have killed them 10 years ago. We've been able to diagnose cancer. We've been able to get people the treatment that they need in order to have the quality of life that they deserve here in Lake County. And that's why I think the district is so critical to the community that it serves. Thank you.
Yeah, I'd like to jump in. It's Don. You know, the population of Lake County is about 365,000 people. And the uninsurance rate in the county is one of the highest in Florida. You know, the overall uninsurance rate in Florida is probably somewhere in the 12 to 15% range, but Lake County is 23%, which is one of the highest levels in the state. I think that has a lot to do with primarily with the non-urban and agricultural nature and the service industries that we have in Lake County, but insurance is few and far between for many of the county residents. There's also the issue of economic cycles. You know, I've been through a couple of economic cycles in Lake County now since I've been here. And when the economy goes down, such as it does for COVID, there's an ever greater number of people who lose their jobs or are temporarily displaced. And even if they might have had insurance, that insurance has been lost. So the safety net of clinics that are out there, the free clinics, are just vitally important. I think you heard already about the Waterman Clinic. We also sponsor a clinic through the Baptist Church here in Leesburg that sees 8,000 patients a year. So, you know, these clinics are the primary alternative for folks who have no other way to find continuity in medical care. And continuity in medical care is very important because if you don't have continuity, you wind up becoming episodic. And when you're episodic, that means you delay your care until you hit a crisis, and then you go to one of the local hospital emergency rooms. And usually that results in a catastrophic negative outcome. So I think, you know, we are so grateful to the people of Lake County who have offered of their treasure and their wallets to support this effort. But it is a vital service for the community, and thousands of people are seen each year in these free clinics as well as in the hospitals for emergency surgical and other procedures.
Yeah, I'd echo
Wonderful.
that.
Oh, I'm sorry.
I would echo that as well. When I take a look at the taxing district and the amount of people it helps, it truly helps make a huge difference. I do believe that in a community, we invest in what is important to our community. And, as we turn around and look at the statistics and see the number of uninsured in our community and what that means to them, this is really vital for them as it relates to not just the hospital side, but really the clinic side. And as Rick was saying, the mental health side of this equation as well. It all encompasses each other, and it just makes the whole thing work. So I do believe it's very important.
Wonderful. Thank you so much for your responses. And I'm just going to ask the second question. If one person could answer that for the sake of time so we could move on. The question is as follows. Can the hospitals and our clinics survive without taxpayers' money? One person, please.
I can say from our perspective, we would not be able to provide the services that we provide without the taxpayer dollars. There aren't other funding sources. And I said before, Florida is low in their per capita spending, as well as the area we're in. So it would not be something that we could continue to provide those services.
I can chime in. It'll be two people. I think the hospitals will survive. Again, as nonprofit organizations, we invest what we have right back in the community. So the question is, what services will we provide in the community? And that becomes the bigger question for us that we have to wrestle with. I think the clinics, they run very, very razor thin with a lot of volunteers and a lot of help. They tend to be one of the most economical safety net parts of this equation. I believe strongly in our clinics, and I think they will have a very difficult time surviving. And then obviously, as Rick mentioned, the mental health capacity is crucial as well. And today, when you look at the state of Florida, it's an area that we need to invest in already. We lack huge investments in the mental health already, and this does help tremendously. Without it, it just puts one more service in jeopardy that I think we need in our community.
I agree with you there, and I'm going to be the third one to just say something really quickly. And when I did a tour of community health centers, and I was told that with the pandemic on the rise, the amount of patients increased specifically within mental health needs above anything else. And so I thought that was very interesting. Thank you so much. Khalid, we'll move on to you. Khalid has two questions that he would like to ask of you as well.
Khalid, unmute yourself. Khalid, unmute yourself.
Okay, 1 second.
There you go.
All right. My mostly concern is the homeless people, because I had a business in that community for almost 13 years. I know them very well, and they mostly have no insurances or just scared to go to the hospital. But my question is, what ways do you provide access for the homeless to get tested for COVID-19? And is there a mobile unit that goes in the area that they can be tested? Or because I see them, they're sitting in the groups, no distance, no follow guidelines, nothing. They just like, they don't even care. But they can spread the disease to other people who's around them or close to them. But is there any way they can be tested, or a mobile unit can go over there?
Yeah, I'll try to answer that. We do serve all people in Leesburg. Whoever comes to us for medical care in our emergency departments is not turned away. And we're very fortunate because of our affiliation with the University of Florida. We have the ability to administer a rapid COVID test within 15 minutes that can pretty effectively distinguish as to whether a person has COVID positive or not. Now, the issue though, which I don't know that I can answer your question, Mr. Khalid, but the question is, are they going to come to us or not? Or are they just going to remain out in the outdoors? And I don't know if I have any control over folks that wander the community, but if they do come to us and they're seeking medical care, no one will be turned away. And if they have any indication of any kind of flu-like symptoms, we will administer a rapid COVID test. And of course, if they need to be hospitalized, we hospitalize hundreds, if not thousands, of uninsured people each year, and we'll take care of them as to the best of our ability. And there's only one tier of medical care. That's one of the great things about having a not-for-profit hospitals in Lake County. We don't offer a second tier to those. We don't turn folks away. And I'll tell you one thing, I also operate a hospital in Sumter County. And since those hospitals have gone private, both hospitals, well, one hospital is private, but since that hospital went private a couple of years ago, we have a lot of people that are being dumped, into Sumter County from Marion County with cancer, with significant medical issues. And of course, at our Sumter County Hospital, we don't turn anybody away either.
I'd like to add for the clinics, we work very closely with Mid-Florida Homeless Coalition. I'm on a few of their boards. We also work with the Open Door, and Livestream may want to jump in as well on this. So we have a great relationship. If we have a homeless individual who needs services beyond the clinic, and it also goes in reverse, and the Open Door or Mid-Florida Homeless Coalition has an individual or a client that needs medical care, they know where to refer those clients. Same thing in our hospital. Our care managers, when they identify somebody that comes through the ED or is an inpatient at the hospital who is homeless, we work with the Open Door. And again, the Open Door is particular to our area and our service area. It's our closest provider to offer wraparound services for that individual and make sure that they get the care that they need.
And I think the population that we serve is the homeless population, the uninsured. We're talking about people that others don't want to serve. And we have been able to come up with creative ways to get the individuals the services they need. Unfortunately, those that come to our hospital, because it is under a Baker Act, would not say that they like coming, but we're able to get their lives back on track. As Melissa was mentioning, we do have an Open Door, which is our drop-in center for homeless individuals who can come in and they can actually get services. They can get a shower, they can get food. We have referrals with a lot of our community partners. And basically, when it comes to COVID, when we know that someone, we screen everybody and we take their temperature. And if someone is symptomatic, then we work with our partners to get them the services that they need. And we also have been able to provide on-site testing to help identify individuals who may be COVID positive and try to get them to the services they need. So I think that we offer a lot of services to the homeless population.
I think we're lucky in North Lake County with the working relationship we have with our organizations, working with Don Henderson's team there at UF and Livestream, and Rick and his team and our community centers. Everybody really takes responsibility of the community and really works diligently with each other to make sure that our community is served. That's not what I see in other communities. We do see it in some, but not in all. But this one is very nice because the whole medical community is really trying to figure out how to address our community need, not just MyPie, but the whole thing. And that's been a plus to see in North Lake.
It's very good. Thank you.
Wonderful. Thank you so much, everyone. I would just like to add, Melissa, Rick, or David, can you expand on what you mean by wraparound services for those of us who might not know what that means?
I mentioned it. What I meant is, as far as other services, so for instance, the Open Door, other homeless organizations, they make sure that an individual who is homeless is on a list basically for housing. So they assess a person, I can use the terminology with the Mid-Florida Homeless Coalition, but it would make no sense. But they'll assess a person, make sure that they are then on that list for housing and receive services. So a lot of clients may not have an address. You need an address to be able to apply for Social Security and get checks. And so these organizations will provide an address. They'll get individuals set up with email, access point, showers, clothing, all the services that they need to really get themselves to where they can they can function again in the community and again, get the services that they need in addition to healthcare. So if they go to the Open Door first, they make sure that they get in with maybe the WIN clinic or Waterman clinic, whatever is most convenient for that individual, so that they can get well, they get the medications they need and get back on track for themselves.
And we go one step further. We believe in the holistic approach. We want to make sure, as Melissa said, when people come to us, they come to us with many needs. They come to us with co-occurring needs. And typically people think of co-occurring as substance abuse and mental health. But in our world, it's legal issues, homeless issues, medical issues. There's a whole host of issues that come with that individual. So while we can work hard to stabilize the individual, they're with us in our psychiatric hospital, let's say 3 to 4 days. We have to wrap them around with other services. So once they get back into the community, they're going to be successful. Because our goal is to turn the individuals we serve into productive citizens. We want to get them back in the community. We don't want them to keep coming into the hospital. So we offer things like case management. We offer the primary care services. We work with our community partners because we're not we have a primary care, but the hospital systems they can provide specialist care. They can provide more in-depth care. So when we discharge somebody or someone comes into our system, we assess them for all of those needs. We look at our inventory of resources and match up those resources with the individual. So when they're out in the community, they're getting their medication. They have a follow-up appointment with a psychiatrist. They are able to, if there's domestic violence, we're addressing that. If there is the homeless situation, we're addressing that. Jobless, we have a lot of individuals that don't have jobs, so we have to work and try to get them the best that we can in our community to be productive and to stay in the community.
Wonderful. Wow. That's an amazing service. Thank you all for your service to the community. Next questions are coming from Pam Janelle. Pam?
Hey, thank you, Melody. So, and again, these are open to anyone who wants to jump in and answer. Many families in Lake County are dealing with the loss of full employment due to COVID-19. As a result, many are working part-time or in jobs that don't offer health insurance benefits, or they've just lost their jobs altogether. And a lot of these individuals are considered essential workers. Do the healthcare systems expect a rise in the number of underinsured or uninsured patients over the next year, year and a half?
I know community health centers has seen a dramatic increase in our numbers of uninsured patients just because of the issues you just outlined. And we expect that will continue into the foreseeable future until people, are able to get back to work, get their, their work subsidized health insurance. But we have seen a tremendous rise in our uninsured numbers.
So, Mark, because you were brave and answered the first half of the question, I'm going to go ahead and throw the second half at you, but anyone else can answer both halves of the question as well. The second half of the question is, in your case, the clinic, how is Community Health Centers preparing to meet this increased need?
Really, we just have, there's no magic formula other than, our staff, we run into the same issues. We have staff that, because of, the schools and they are, afraid of being exposed. So we're dealing with some of the same issues internally that we're dealing with our patient population. But our staff generally are very, very dedicated. We've been working very, very hard. We've tried to backfill as many appointments as we possibly can. We had, when we shut down, well, we never shut down, but when basically, the economy started shutting down, and we had in March and April, many appointments canceled, especially in our dental clinics. So we've had a program in place where we've been doing recalls. So we've recalled over 8,000 patients to try now to get them back in for healthcare that they need. They've been, we have diabetics, we have all kinds of chronic illnesses that people were just ignoring. So we've been doing a lot of work to try to get those folks comfortable to come into our centers and get the care that they need. We have pharmacies and they need their medications, and we've been doing tremendous amounts of mail order now. The cost of which is much more costly, but it's so important that we treat the whole patient. So we're just trying to plug holes where we can and move forward, and hope that sometime that it'll turn around someday.
Sounds like you've mastered the pivot, maybe.
We do our best.
Yeah. Anyone else care to take a stab at that?
Yeah, I'd like to share our experience, because there has been a lot of emphasis on the physical characteristics of this pandemic and little attention on the mental health. And we knew going into this that there was going to be a huge need for mental health. A lot of individuals have lost their jobs. We have seen a lot of families that they're unsure what's going to happen tomorrow with their children. They're all trying to figure out, do I send my child to school? Do I go from home? If I go stay at home with my child, who's going to work? And just myriad issues. We started seeing about a month and a half into the pandemic, a huge increase in our census in the psychiatric hospital. And when we looked at our trends, it was primarily males over the age of 50. And when we started to look even further, we found that many of these individuals had lost their jobs as a result of the pandemic and felt at their age, as they were getting closer to retirement, no one would want to hire them. So they came to us desperate in hope. They wanted to end their life because they did not think that they would be employable. We also saw a lot of individuals as a result of the uncertainty and what was going on, because right when the pandemic hit, we also had civil unrest in this country. We've had a lot of things that have been thrown at us in the last couple of months. And what people are going through is a lot of anxiety, a lot of fear. They don't understand or know what's going to happen tomorrow. So our facilities are filling up left and right. And what are we seeing? People have lost their insurance. People don't have, or they're on the last few weeks of their benefits, or whatever the case may be. So what did we have to do? We felt that we had to try to divert people from our hospital. Our hospital is our most acute care piece in our equation. So we created what is called a mobile response team. And I don't know if you've seen around Lake County, but there have been quite a few billboards that we put up with a COVID-19 helpline so that we could serve as an intermediary. And then instead of having people in crisis come to us, our team is going to them. We're working with law enforcement to, when they're seeing someone that's in crisis, instead of automatically putting them under a Baker Act and bringing them to LifeStream, we actually have a team of individuals that are going out or even talking to people over the phone and getting them through whatever this crisis is. I think we're going to see more and more of this. Unfortunately, as we end the week at overcapacity, we think we're getting into the weekend, we're going to have more people coming into the hospital. What can we do? And I can tell you that we have run over capacity. We have really seen more and more people that are feeling helpless, hopeless, depressed, anxious. They don't know what's going to happen.
Thank you, both for that answer and for the work that you're doing. We have a bonus question, and it looks like we have a little bit of time, so I'm really excited to be able to ask this specific question because it's going to allow you to tell the part of the story that maybe nobody's heard yet. And this question is, what are some myths that are circulating that you would like to clear up, or what is the question that you would like to answer this evening? I thought you guys would be all over this.
Well, I'll certainly take a crack at it. One of the big myths that's out there is that there's some other money or there's some other pots of money out there, some other federal funds, some other secret slush fund that we have to draw upon. And, you know, that's really, truly one of the big myths that's out there. The hospitals here locally have to bill and collect whatever they can collect out of the community based on the insurances that people have. And there is no magic bullet. There is no other source of funds other than the North Lake Tax District. A couple of years ago, under the Republican administrations in Florida, we were actually able to take our tax district monies and match those and basically get a 2-for-1 match in order to buy up our Medicaid rates. Florida has some of the lowest Medicaid rates in the nation. Florida on a per capita basis is number 48 out of the 50 states in terms of Medicaid rates and Medicaid funding. Basically, a family of 4 has to make less than $5,000 a year in order to qualify for Medicaid in Florida. So what that means is that, pretty much it pushes everybody into the uninsured ranks unless you are simply destitute or you have a medical issue, you're disabled or whatever. So the bottom line on that, of course, children are pretty well covered in Florida. We don't want to leave them out. But if you're a working adult in Florida, you basically have to be destitute or have no income in order to qualify for Medicaid. So Medicaid rates for us are actually 50% of Medicare, which is actually 30% less than what commercial patients pay. So I think the big myth is that there's some other secret slush fund out there that we're drawing upon, that we have some other secret funds that are coming in through some area. And that's really not the case. We sort of have to make it or break it. And these funds, even though they're important to us, they just help the overall not-for-profit enterprise. And, it helps us improve the quality of care. It helps us buy needed equipment. It helps us take care of many, many hundreds of homeless people who come to us and other uninsured each year who need a quality care. So it's an aggregate. There's no specific thing I could point to, but all of it helps improve the quality and the availability and accessibility of care for every resident. And I think that people in Lake County should know that it's not that way in many counties. There are places in the United States where the emergency rooms have all been closed, and all they're doing is passing the patients from one homeless area to another. And I really have to give credit to the people of Lake County who voted overwhelmingly to keep the tax district, because it not only supports the free clinics, but also the vital services of the hospitals. And I think it's hard to answer specifically, what we do with the money, but we basically put it in our regular funds and use it as we see fit the best to try to provide the very best quality services that we can.
Thank you. And I want to thank you specifically for bringing out the point that it benefits all the residents of the district and not just those who are in need of those services. Does anyone else have a question that we haven't asked that you feel needs to be answered?
David, you took your mic off. Did you want to respond?
Yeah, I was going to jump in there as well. I think, Don answered that very well, so thank you. I think when you take a look at our organizations and they turn around, a lot of people say, well, you're attached to a really large organization. You're attached to Advent Health, or you're attached to UF. How does that work in our community? You've got a big system someplace else. Surely they'll help you. There isn't any magic, bullet, anything out there that's like, okay, this is how it works. The reason why we attach ourselves to major organizations is for scalability, to actually provide more services for less. And when you're looking at those things, you're saying, how can I scale a service and provide that for a cheaper and cheaper price with a very high quality? And many times that scalability allows that to happen. When you take a look at Lake County, for instance, over 80% of the folks that come and use our services are either Medicare, Medicaid, or self-pay. It's very high percentage, much higher than anywhere else. So we've had to, over the years, make sure that we provide every service we can at affordable price. And when you take a look at the uninsured continue to rise, that's a big struggle for us. Now, when we started the year this year, and you take a look at our unemployment in Lake County, it was running somewhere around 3.5%. When COVID came, we jumped up into the 18%. Now we're running 17, 18, 17, 16%, somewhere in there. And although we haven't seen, at least we haven't seen a huge decrease or increase in uninsured right now, we do believe that the furlough that's transpired, people are still sticking on to the benefits. And we do believe we're going to see that a lot more coming in Q3 and Q4. Now, we will start seeing that in the clinics already. So we're starting to see some volume escalation in the clinics. But I do believe that a lot of this will start happening in Q3, Q4 when the furloughs start dropping off. And the reality is when we're not going to get to the unemployment rates that we were when we started the year, I think that's going to put a lot more pressure on a lot of our systems, including healthcare, including our educational systems and other systems like that. We're going to see a lot more issues coming through there that we'll have to handle as a community.
Okay, I'm looking at the Q&A, and there's two questions that are somewhat tied together. First of all, what is the geographic area of the North Lake Hospital district? And then what are the powers of the board members of the district?
So the geographical district, I'm bringing up the map on my own screen. Nancy, can
I'm happy to kind of, I shared the map with them on that question. I tried to share some of the question answers that were kind of fact-based on the
wonderful, thank you.
District. And really the district, if you think about it, kind of starts down in Okahumpka, right about where South Lake starts, and comes all the way up and goes into Fruitland Park, Lady Lake, then over the Dead River Bridge into Eustis, Tavares, and the northern cities of Lake County. And that's a pretty good description of the overall district. The powers of the board, really their main power is to levy the mill, up to 1 mill. And then they oversee the allocations and the budget for the district. So they oversee the allocations of the funding and of the district. They have an auditor who provides them with audited information about the claims submitted by the providers. So they see that data as well. So they're the oversight, right? They're the oversight group to make sure that the dollars are being spent as required by the legislation.
Wonderful. With South Lake not having a similar district, do you see a greater than expected number of indigent cases from Claremont and points south than what you would expect?
We have at community health centers, we have our Groveland clinic, a smaller clinic in Claremont, and we just opened a very large center down in the Four Corners area. And already our uninsured numbers are significantly higher than what we normally plan for those areas. So yeah, the uninsured are finding their way to us. I know that, and I'm sure they're finding their way to everybody else that's on the panel too.
Okay, how much is the tax, the millage rate?
But Dawn actually answered this one earlier. It is currently set at 0.97 mils. So they rolled back the rate slightly on at the last board meeting. They have the power to raise up to 1 mil, and depending on the value of the property for residential, it's anywhere between 100 to 150, maybe is up to 200, but most of the time it's in that 100 to 150 range for a residential person. And just to be clear, the district, so even though we will as providers treat people from outside the district, currently that reimbursement is just stuff we do on our own. We are not able to submit that to this district for reimbursement.
So are you saying if somebody comes from Four Corners that you can't be reimbursed for that?
Not from this,
That's
not from
correct.
the funds from this district, correct?
And yet you still serve them?
Community health centers does, yes. We serve everybody. Yeah.
Absolutely. Yeah.
That's incredible. That's wonderful.
I think it's important to know that we serve everybody that comes through our doors, regardless of who they are, regardless of what they pay. That is our community-minded spirit and our non-for-profit status. That's what we do. So there is, we're going to continue doing that. You know, there is a cost for that, and we appreciate the taxing district and what it provides, but there's a significant amount of more services that we provide in this community that is not reimbursed, and it's quite large. And that's just kind of our mission as well.
Okay, let's see what else is here. What about women's services, specifically mammograms?
Yeah, I'll take a shot at that. So, you know, we have tried to focus our women's services to focus on the annual time, which of course is October of every year. That's Women's Health Month and also Breast Cancer Awareness Month. So what we try to do through our hospital foundation is collect funds in order to be able to provide vouchers for women of either uninsured or lower income below the poverty level so that they can redeem these vouchers. We hand them out through community agencies so they can then come and get the mammograms that they need in order to maintain their health.
And for the clinics, we work to refer patients to the hospitals for those mammograms, whether it's vouchers or foundation funds that we can use. We also work closely with the breast and cervical cancer early detection programs with the Department of Health based on qualifications for the patients and what location and what service is the best fit for that patient.
Excellent, thank you, Melissa. And then the last question I have, what is the current qualifying poverty income for a single person and for a family of 4? If they have assets of a certain level, does that disqualify them even though they meet the income guidelines?
Yeah, I tried to answer that question. It's I just looked it up. It's about $12,000 for a single person in annual income per year, below at $12,000 or below, and it's about $22,000 for a family of 4. I don't really know the answer to the question of if you have other non-monetary assets, how that would be calculated. Phil, do you have any idea on that?
I don't know exactly how the income levels are calculated. There's a tremendous amount of information that every provider has to get from a resident that to qualify them. The HCRA guidelines are pretty thick and explain what you have to qualify. But the main things are, as you said, there is an income level. There's a requirement that you have no other insurance and that you are a resident of the district. Those are kind of the 3 broad categories. But the income, there's tons of paperwork that goes into that, and we all work hard to get our residents qualified.
Excellent.
Yeah, I mean, we try very hard to get our folks on Medicaid or any type of insurance. That's something that we work very hard to do. And those that do qualify for uninsured, we go through the process of either using the taxing district or we just absorb it ourselves. Anything that we submit to the taxing district, we do have an auditing company that looks at it, understands that they audit us, they make sure that everything is done well. I mean, we actually have a very solid independent process that a lot of good checks and balances, I think, with this taxing district to make sure that that this process is handled very well, very efficient, very cost efficient. And from an organizational perspective, our goal is to migrate people from a higher expense area like an ER into the clinics. I mean, that is the right methodology. So we do our best to move folks into the clinics where it's actually more cost efficient to treat in certain areas than the hospital. So we do our best to do that as well.
Anyone else? Well then, Melody, those are all the questions in the question box. So I turn it to you.
Wonderful. Thank you so much. These were some poignant questions. I know that after this, you all are going to have to take a brain break. But we so appreciate you sharing about what you do and how the community is affected. So right now, I would just like each of you to give your final remarks and what you would like us to walk away with.
Don, you want to start?
Oh, sure, thanks. So, we think that 2020 is a historic year for our two hospitals that we operate in this region. We have formed a partnership, just like Waterman did many years ago. Waterman, I actually lived in the region when Waterman was an independent hospital, and I think that it was actually kind of sinking into the sand. So you got to give great credit to the Florida/Advent Health system for rescuing them and building a beautiful new facility here to serve the citizens. But we see a similar historic event occurring with UF Health. UF Health is recently U.S. News and World Report came out, and UF Health Gainesville Hospital was rated the #1 hospital in Florida this past week. So it's a tremendous organization, has a tremendous amount of resources, and we will draw on those resources. Having said all that, we still have to provide financially. We have to make it on our own financially. There is no magic bullet. There is no great stream of state income that's going to come to us. But we hope that the citizens will understand that it's all cumulative. Even the small amounts that you might pay, whether it's $100 or $150 in your tax bill each year, adds to that is split first to the clinics and then what's left over to the hospitals. That's all additive. That just adds to the quality of care in the area. And I think that if you really, really want to see some bad situations, I just read in the newspaper today that there was another hospital that closed in Georgia. There are hospitals closing all over the southeastern United States, and those communities are high and dry for their medical care. So, it's easy to neglect these facilities. There's nobody that's really a strong advocate for them. But at the end of the day, if you don't, if you're not willing to support these facilities, you're going to slowly erode them, and then they could face negative financial consequences, which would cause them to potentially have issues in the future. So I would like to think that you would think of these charitable organizations, both Advent Health and UF Health, as a cumulative additive thing. The more you can support these organizations, the more you can keep your healthcare business locally, the more you can join our community boards, our hospital foundations, and give of your time and treasure, the better off the outcome and the better off the quality of care we'll be able to give to all of the citizens. And I'd like to thank everybody today for your interest and for caring about our local hospitals. They're truly a treasure. We're so blessed in Lake County to have these quality facilities. And we'd like to continue the contributions of the tax district in order to continue to build the quality of care that we provide for the citizens who live in this area.
Wonderful.
Thank you, Don. First of all, I want to thank you guys for putting this together. Again, Nancy, team, thank you, the candidates, everybody for the questions. Truly appreciate it. Again, if we didn't answer all the questions that you have, you have our emails, our numbers, please feel free to get a hold of us. We're more than happy to go through any additional questions that you may have. And if you're listening in as well, please feel free to let us know. We're happy to give you tours. We're happy to go through more explanations. I think understanding the situation is very important. As you turn around and look at North Lake County, we have good healthcare systems with UF and Advent Health, both there with LifeStream with their clinics. We are working very diligently, both together and independently as well, to elevate the healthcare in our communities. And it's because we care about our community. We want it to do well. We recognize that we don't know when we're going to need healthcare, but when we do, when it's me, when it's my family, when it's, then you want the best healthcare that's out there. It's something that you got to pre-plan, you got to invest today to make sure it continues to grow with this community. And it's like Don said, it's all additive. When you have an insured rate that, the numbers that we have, and when you have the self-pay that we have, it does take a toll in our organization. And as non-for-profit organizations, as I mentioned before, everything that we make, we reinvest right back in the community, which has truly helped our community become much stronger. And as I mentioned, when you turn 65, you're 5 times more likely to use healthcare services. And when you do that, you want to make sure it's good healthcare services. So invest when it's doing fine. Don't, if it's not doing fine, and we do see hospitals that are closing, that is not the situation we have today. But we are continuing to invest to make this a better and better place. So I do appreciate that. I do appreciate, again, LifeStream as well. They've done a great job. We work very hand We work very closely with them, with our behavioral health services and in the clinics as well. If you go to a clinic and if they need additional services, we take those services and we provide a lot of different imaging and other services for our clinics as well, to make sure that our folks can be treated in the lowest cost setting. So I do appreciate the work that you guys are doing. And as an independent taxing board district, thank you for the work that you do every day as well.
I just would like to echo what our community partners have said. We are a system of care, and we can't do it all, and they can't do it all. But by having good partnerships and being able to refer people and making sure that they're getting services, that's really what community is all about. I can tell you that the dollars that we get from the hospital district go right into services. We purchase Baker Act beds, and we also help with our primary care clinic to provide services. The dollars are not fluff. They're not extra dollars. These are dirt. We are a community-based, not-for-profit organization. So, we don't have a lot of money. And as I shared with you earlier, the behavioral health in this state is the worst in the country. So we have to be good stewards of our dollars, and we have to make sure that we can stretch them as much as possible. And what I mean by stretching is we go to our community partners and ask them, what can you help us with and what can we help you with? And we have teams that are going into the emergency rooms trying to take the people that we serve out of the emergency room so that they're not clogging up the emergency rooms. But it takes, and I say this over and over again, and it's cliche, and I understand that, and it's been used so many times, but it does take a village to raise a child. And in this case, we know that mental health is essential to healthy living. We know it has an impact on health. We know it has an impact on family. We know that it has an impact on our society. And by all coming together as partners with the hospital district and with the hospital systems, we are able to provide tremendous care. We're fortunate enough to be in 6 other counties, so I'm able to see the health system in those other counties, and I'm proud to say that we work here in Lake County because we have the best system that I have seen. So thank you all very much for putting this together. This was tremendous. Hopefully that individuals understand a little bit more about what the hospital district does and some of the fallacies that surround it. I can tell you without that funding, we would not have those services, and it's very critical. And you may say to yourself, but I don't have anyone in my family who has mental health issues. And I'll end the same way that I started. 1 in 4 Americans are affected by mental health. So thank you all very much.
I'd also like to just echo what David and Don and Rick said about community. As a community-based primary health setting, I'm fortunate enough to be able to work with each of your organizations, and that relationship is very, very important to the community as a whole. We wouldn't be able to get our patients some of the the behavioral health needs. Although we do a little bit, we count so much on LifeStreams to help us because 60% of the patients that generally come into a federally qualified health center have some sort of behavioral health need. Whether it's food on the table, it's something that's creating an issue. Same way with the hospitals and imaging, we would not be able to get our patients healthy if it wasn't for being able to have those coordinated relationships. I really appreciate it. And the taxing district really does help bring that all together.
I guess it's back to you, Melody.
Okay, I was waiting to see if Anita could say something, but I guess still muted. But I'm sure that our listeners can reach out to Anita.
So Melody, Anita, go ahead.
Yes. You very well may be able to hear me now. I have been answering some of the chat questions. Didn't want to interrupt, but I apologize that my system has given me a little precarious position to be in tonight, but thank you so much. I just want to thank those who have collaborated and participated tonight. It is a joy to serve the residents of Lake County. Just quickly to say that I have been here at Waterman for 32 years, and I have been involved with watching our organizations across the entire county serve those most needy. And it is truly a blessing to be able to say that I have seen lives change through these tax district dollars. We are talking about real people who are our neighbors, who are residents of our communities. And it is truly deeply appreciated by all of the entities that spoke tonight. And candidates, I just am very thankful that you have interest in learning more and wanting to serve our community as a representative on this board. And I probably speak for all. We are welcome and open to take any of your further questions or comments, and happy to respond. So thank you, and I appreciate the opportunity to close.
That's perfect. Thank you, Anita. And thank you, Melissa, Dawn, David, Rick, Mark, Phil, Nancy. Thank you all for taking your time out and sharing. Oh my goodness, I'm going to walk away. There's so much that I learned this evening, and I'm so grateful, as I know that our listeners are grateful as well. It's a whole new concept of what North Lake County District has done for the community. Don't you agree, Pam?
I think it has been really, really productive, and I so appreciate everyone's time. And accessibility is really important for people who have never run for office before to make a phone call and get to meet with a CEO and a COO and a CFO. It is beyond compare, and we thank you from the bottom of our heart.
Yes. And on that note, if there are no other questions or comments, we would like you to first stay safe, because there is a hurricane on its way this weekend. So make sure that you stay safe. And we want to thank you again. And please reach out to these wonderful people who have taken their time to find out any more information. If you didn't get a chance to have your question answered on the chat group, they are available to answer your questions. So thank you again. We thank you, panelists. We thank you, Democratic Executive Committee. We thank you, candidates. And most of all, we thank you, listeners. Everyone, have a great evening.